When asked about the proposed policy by the National Health Insurance Administration, Lin Wei-wen, a Taiwan Adventist Hospital cardiologist, thinks that the proposal depicts the doctor-patient relationship as a purely commercial one, and that shouldn't be the case.
And while the Consumers Foundation approves of the policy as it prevents hospitals exploiting the public with highly priced medical devices, an outraged Lin says doctors do not rely on the sale of medical devices to make money, and the NHIA should listen to opinions in medical circles when formulating policy.
This small, delicate pacemaker can control heartbeats and stimulate heart pulsations by emitting electric currents. Stents that can alleviate cardiovascular blockages belong to one of the 8 categories of devices that the National Health Insurance Administration is planning to set caps on patient payments. Other commonly seen devices include artificial hips and artificial lenses. There is a wide variety of brands, prices and functionality of the devices. Take pacemakers as an example. There are nearly 20 different kinds on the market, and prices range from 20,000 NT to 80,000 NT. But they're planning to set a cap of 40,000 NT on the devices. The Consumers Foundation reckons it's a good policy as it prevents companies and hospitals from ripping off the public.
We hope there can be a cap on prices. There can be extremely large price gaps between different medical institutions, even though they use the same medical devices. I've listened to their explanations, but I just can't accept them. How can they be speaking like this? If I asked them, what is a drug-eluting stent, they couldn't tell me. So how can they be setting prices? They have no idea what this thing is. And there they are, evaluating something purely on pricing. They should listen to opinions in the medical world before they decide if a device is good or not, or whether they should use a fixed price. The only correct way to go about doing this is to discuss this with medical experts.
Dr. Lin Wei-wen, a Taiwan Adventist Hospital cardiologist, says treating doctor-patient relationships as business partnerships not only degrades medical expertise, but also allows for devices made of cheap, low-quality material to be sold for good money. And when it comes to the argument that medical materials are a source of income for hospitals, Lin thinks that personnel, R&D, technology and costs at each hospital are different and can't be lumped together.
If a patient trusts his doctor and is willing to come to a hospital for treatment and pay a little more, it's actually okay. If a patient or his family members are concerned about the price, it's actually possible to do an online comparison. It's a transparent and open channel.
Doctors are appealing for the sale of medical materials to return to free market mechanism with transparent pricing. The public can choose devices according to their requirements and financial means. They argue that as long as the government raises the public's awareness and strengthens publicity about this issue, the public will naturally not be shortchanged.